Right. So good day, everyone. So for the class, I'll be presenting to you the format on how we are supposed to give your case presentation. Okay. And then also, class, I'll be explaining to you the rubrics on how we're going to grade your case presentation after this. Right. So for you, for ano, okay. So before you start class making your slide presentation, okay, fill up nyo muna itong ating format para guided kayo kung ano ilalagay ninyo sa inyong mga slides. Okay? So here class, we'll start off with the case title. Okay, kung ano yung case na ipapresent nyo. Is it urinary tract infection, upper respiratory tract infections, and so on and so forth. Then your names as presenters. Okay, dito sa side na to. Right? Then, date of presentation kung kailan tayo magpe-present. So, under this one class, under the case, ika-copy-paste nyo lang dito yung case study ninyo. Right? So that you can just, type in yung case study nyo dito. Then afterwards, you're going to start with the pathophysiology of the disease. Right? So, dito nyo isusulat yung pathophysiology ng disease ninyo. Okay, based on the case that you're going to present. And then, class, we start, then after that, after the pathophysiology of the disease, we start with the SOAP analysis. Okay? So, under SOAP analysis class, dito natin ilalagay yung patient demographics. Age, gender, economic status, rich, poor, ganyan. Pero class, syempre, kung di naman stated sa case niyo, just put NA. Okay, height, weight, kung given, kung hindi naman, NA nyo lang. Right? Or any information class, any demographic information na sa tingin niyo ay importante para sa case ninyo. Okay, you can add here whatever. Okay? Yan, pwede nyo dito BMI kung sa tingin niyo ay importante yon for the demographic information. So class, that I leave to you. Okay? Basta kailangan syempre may laman tong demographic information natin. Then, of course, patient history. Alright? Only apply class, only use what's available sa inyong case. Kung walang past medical history, huwag nyo na ilagay. Okay? Alam naman mag-invento tayo ng past medical history ng patient natin kung hindi naman given sa case ninyo. Right? Medication history, review of systems, allergies. Okay, that's up to you guys. Now, of course, class, dito natin lalagay yung subjective at saka objective information natin. Right? So, basically, class subjective, yung mga nararamdaman ng patient natin. So, sulat dyan, masakit ba ang ulo? May upper abdominal pain ba? Lower abdominal pain? Okay? Headaches? Ganyan, so on and so forth. Okay, dyan yung susulat yan. Then, objective information class or any information that can be derived using laboratory findings. Like, say, for example, cholesterol, blood pressure, APTT, PT. Okay, again, depende sa inyo to. Or depende na sa case na meron kayo. Now, for patient assessment class, here, you have to identify the drug therapy problem. Okay, so 7 lang naman yon. So, I'm sure, alam nyo na to. Okay, please lang class, drug therapy problems, only the 7 drug therapy problems. You don't have to write here drug interaction. Okay, kasi kung drug interaction class, either dose too low, dose too high, adverse drug reaction, yung mga, yun lang i-identify nyo. Then, after nyo ma-identify class yung drug therapy problem, explain the implication of the findings of your assessment. Meaning, is it significant? Okay, significant ba yung nakita yung drug interaction? So just explain class why do you believe na yun yung drug therapy problem na nakikita ninyo. Then primary impression. Now this one class would usually be based on your clinical judgment or the doctor's diagnosis. So isusulat nyo lang dito. Primary impression. Patient has sepsis secondary to a wound infection. Okay? Basta class kung ano yung nakasulat sa case niyo diagnosis or what you believe, kung hindi nabigyan ng diagnosis sa case niyo, then based on your clinical judgment, what is your primary impression or what is the diagnosis for the patient? Alright? Then class, afterwards, you have to put here the clinical guideline that you will be using. Syempre class, you'll be doing a separate evaluation of your clinical guideline. So you'll be using the agree to. Okay? So after using the agree to class, syempre, sa slide presentation ninyo, papakita nyo na lang yung title nung clinical guideline and then the agree to score na nagawa nyo by pair or sa group ninyo. Okay? So here class, sa clinical guidelines, baliktad. To be used. So give the title of the clinical guideline to be used, including the agree to score you have given it. And then after this one class, part pa rin ito ng assessment, Okay? Ililista nyo class isa-isa yung symptoms ng patient. So, pwedeng sa symptom class or signs. Or signs. Dito halimbawa class ilalagay nyo ang nakita yung symptoms ng patient is headache. So what's the goal of the treatment? Okay, it's to alleviate headache. Alright? Or nakita nyo may hypokalemia. Patient has hypokalemia. So what's the goal of treatment? Return the potassium levels back to normal. Okay, very important to class, especially when you're starting to treat our patient. Kasi dapat, bawat problem ng patient natin, bawat nararamdaman niya, okay, may kaakibat yun na treatment. Kung kailangan ng treatment talaga. Baka pwede naman kasing complementary lang. Okay? So again, it depends. Alright? Basta class, kung ano yung symptom ng patient, ano yung goal ng treatment mo? It's to whatever. Alright? So halimbawa, ang symptoms ng patient is, may fever. So kailangan to alleviate the fever or to normalize the temperature. Patient has bacterial infection, say for example. So anong goal of treatment natin dito? Ilalagay natin dito would be elimination of the bacteria. Right? So again, this one depends on the case nyo. Now class, I'll be looking closely at this one. Right? When grading your paper. Kasi dito ko makikita kung naiintindihan nyo ba talagang case niyo o hindi. Alright? Okay, then for the plan class, list of possible solutions for each problem that you find. Okay? So formulate a list of possible approaches to the patient's problem. Okay, say for example, kung siya ay may GERD, may peptic ulcer, okay, ano yung mga possible pharmacologic or non-pharmacologic treatment na pwede natin ibigay sa patient. Now, of course, class, the recommendation that you'll be putting here should be based on the clinical guideline. Hence, class, importante sa akin dito, naka-indicate saan sa clinical guideline nyo ito makikita. Okay, halimbawa, patient has for the peptic ulcer disease, patient will be using ranitidine, kung anumang dose, blah, 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 ganyan. Isusulat nyo yung class, anong page sa clinical guideline, makikita yon. Okay? Or, during your presentation sa slides, okay, yung katulad ng ginagawa natin, binabox nyo sa clinical guideline. Okay, binabox nyo yung sagot doon. Right? So, no alternative should be prejudged or omitted. Give the reason why you are considering this possible solution. Then, class, for the rationale of the recommendation, okay, explain why you chose the possible solution treatment, again, based on the clinical guideline. Ano ang reason bakit siya rin pinamaganda? Halimbawa, patient has stroke, or patient has, patient has stroke. Okay, so pa-take-home medicine is clopidogrel. Alright, so halimbawa, patient will be taking clopidogrel. Okay, anong reason bakit clopidogrel? So, syempre, ilalagay nyo dyan, halimbawa, based on sa clinical guidelines, it's the best medicine, it's the most cost-effective medicine for preventing another onset of stroke or MI. Okay, so again, depende na yun. Then, class, therapy-specific variables, bawat isang gamot na ibibigay sa patient, isang ganito. Okay? So, isang gamot, isang ganyan. So, kung 5 ang gamot na ibibigay sa patient, 5 ganito, itong naka-highlight na to, ang ilalagay ninyo dito. Alright, so medication, anong pangalan ng gamot? Dosage form, is it IV, oral? Okay, dose and dosing interval. Duration of therapy, how long will the patient be treated with this medication? Ano expected outcome when it comes to this outcome? And when will this outcome be reached? So, expected outcome, halimbawa, kung yun ay fever, alleviation of fever. Alright, gaano katagal? Could be 3 days. Depende. Okay, makikita nyo naman yun sa clinical guidelines natin. List of possible side effects or adverse effects, especially those that would warrant physician intervention. So, dito nyo kasi lilista yung mga possible side effects ng bawat gamot. Okay? Next one will be the signs that the treatment is not working. Okay? Like say, for example, if you're using antibiotics, if patient does not recover from fever after 3 days, okay, that could be a sign that the treatment is not working. Price of the product, in pesos, please. Okay, make sure, class, yung product na i-recommend niyo ay available naman sa Pilipinas. Alright? And then, counseling points. Things you need to remind the patient regarding their medication. Right? Then, kung may complementary medication kayo, class, ay dadagdag, same thing. Like, say, for example, gagamit kayo ng ginkgo biloba, MX3, okay, yan. Right? Then, patient-specific variables, kung may mga hindi ako nabanggit dito na kailangan pang-treatment ng patient natin. Right? And then lastly, class, consider the drug interaction. Okay? Here, class, any interaction with the medications or use or recommended and what to do just in case an interaction is seen. So, if you see a possible drug interaction, let's say, for example, isa sa mga nakita niyong problem would be sa existing medicines niya. Okay? Pwede mag-interact sa isasuggest yung medicines. Alright? So, you have to recommend what to do just in case you find a drug interaction. Right? Should I space the treatment? Okay, like space for 5 hours each? Okay, kailangan ko bang bawasan ang dose ng isang gamot? Right? And depende na sa inyo to. Right? On what to do with the drug interaction. Now, let's go, class, to the rubrics for the case presentation. So, I'll be grading you, class, based on the content, your slide presentation, and your presentation itself. Okay, so, a big chunk, class, of the presentation will be based on the content of the presentation. Sabi nga natin, kung maayos, class, ang content ng inyong presentation, sigurado akong maayos din nalalabas yan. Right? So, 60%. So, will be based on the completeness of the case format of the presentation for every detail lacking. Halimbawa, kulang ka sa symptom. Binasa ko yung case. Sabi ko, ba't di nga nilagay yung symptom na to na dapat i-manage din? So, every time kasi makakita ko ng mga ganon, minus 2 points sa 30 points na to. Okay, from the total score. Right? So, ganun siya. So, halimbawa, nakita kong kulang isa, then magiging 28 out of 30 to. Na kung kumpleto naman, class, ang buong, ang content, halimbawa, kumpleto to, may ganito ka for each medicine. Okay, di naman kailangan complementary kung wala. Sabi nga, if applicable lang naman. Alright? So, nakita ko, kumpleto naman yung plan and list of possible solutions. Tapos may rationale. Basta kumpleto itong buong content na to. Right? If that is complete, class, then good. I'll give you guys a perfect score of 30. Alright? Okay. Basta pag every time na may nakikita kong mali, kumbaga, every time I read your paper, I'm assuming it's already perfect. Okay? I'll give the perfect score. Every time may makita lang akong mali, minus 2 lang ako ng minus 2. Okay? Huwag kayong mag-alala. Hindi naman siguro ako magda-negative dito. Okay? Next would be your slide PowerPoint format. Okay? So, the PowerPoint, class, should be white in background. Okay? Huwag muna tayo maglagay ng graphics kasi minsan mabigat sa yun. I mean, huwag kayong maglagay ng design sa slides. Minsan kasi mabigat yung file size nun. Mabigat yung file size. Okay? So, basta plain white lang muna. Okay? Just plain white background. Yan. Yun lang. Right? Kayo nang bahala sa kung ang pictures na ilalagay niyo, pero dapat it should be relating to your case. So, background of the slide should be in plain white. So, if it's already in plain white, I give you 2 points. Slide should have 9 text lines or less, except for tables or graphs. Okay? Pag sabi ko, class, 9 text lines, if this is your, if this is the slide, dapat 9 lang na lines ng text ang makikita ko dyan. Maximum of 9. Okay? Kasi kung masyadong marami na, it will be too crowded. Right? Again, 9 lines lang of text ang dapat makita. Then, presentation uses images when appropriate. Okay, let's say, for example, pakita ka ng ECG or whatever. Okay, whatever graphics you want to put in your slides. So, again, plain white background lang tayo. Slides follow the correct sequence. Okay, so this one, class, would of course be based on how you present your case. So, sequence, diba? Case, pathophysiology, clinical guidelines, SOAP analysis, so on and so forth. Then, the maximum number of slides, class, should be 50. Yan ay maximum. Okay? If it's less than that, okay lang din naman sa akin. Basta not more than 50. Now, for the presentation itself, this will, of course, class, be presented in a video format. So, first things first, if you're able to submit on the given deadline, okay, 5 points automatic. 3 points automatically yun. Okay? Then, class, was able to make, next one would be, gagawa kayo ng video recording, hindi lang dapat voice ang meron. Dapat, class, kita rin kayo. Katulad dito. Okay, just like this one. Okay, you can see me presenting to you. Now, class, you can do this in PowerPoint. Alright? So, sige, pakita ko na lang din kung paano siya ginagawa sa PowerPoint. Alright, so dito ko lang, class, sa record. Then, here, you do record. Okay, so pwede from first line or whatever. Pero, class, ito lang yung pipindutin ninyo. Oops, sorry. Natakpan ko pala. So, ulitin ko, So, pag-open mo ng slide, punta ka lang agad dito sa record. Okay? Tapos record lang dito. Okay? When you do this, class, lalabas na dyan sa slide. Automatically yung parang video recording ninyo. Okay? Yan. So, kailangan may makita akong picture ninyo. Kasi last time, may mga iba voice lang talaga. Okay? Or you can record this using Zoom. Sa Zoom, class, pwede rin naman yun. Right? And you can do it for free, I think. Okay. Anyway. Next, was able to present the case with a video of the presenter. Yun na nga. Okay, so was able to make a video recording of the presentation on the given deadline. Again, 3 points din yun. Able to present his or her topic with mastery. Okay, meaning, alam mo yung nag-uusapan mo dito. Okay, mahalata naman yun from the way you speak, the way you speak during your presentation. Right? And able to present the report in 30 minutes or less. So, class maximum na yung 30 minutes. May mga iba kasi before, mabot ng 1 hour. Alright? So, you can present this class in less than 30 minutes. Kaya-kaya to. Alright? So, for every excess of 1 minute, 1 point will be deducted from the total score. Okay? So, yeah. So, try to keep your presentation class within 30 minutes para acceptable naman sa mga nakikinig. Okay? Alright. So, that's that for our case presentation. So, if you have any questions, class, please, again, feel free to ask or just message me in our GC, or you can always type a comment in our chat box. Right? So, sige. With that, thank you very much for listening. Bye, guys.